Everybody, I'm going to give us about another 2 minutes to see if anyone else is going to be trying to make their way across campus, and then we'll get started because we want to at least be able to field the questions and have enough time to have those questions answered and recorded so that we can always play those back and people will be able to hear and receive the answers to their questions even if it is at a later date and time. So we want to give everyone about another 2 minutes before we get started. Thank you. Okay, I'm going to get started. We welcome everybody that's here. Thank you so much for being present. If you found the time out of your busy day, I know everybody's trying to finish up, especially for our students and our faculty, the last few days of the semester. But we wanted to give opportunity as our responsibility here at Lincoln University for our students, faculty, and staff to have an ability to be engaged and educated about the COVID-19 virus, as well as the vaccine that is fighting the virus right now. Those vaccine discussions we want to have today, we were asked to have those persons that wanted to field questions to submit them in a survey. We did receive those questions, and those will be the ones that our panel will be discussing, as well as any that is fielded from the audience if we have time for that. Our introduction of our guest panelist is Dr. Denise Johnson, was an MD, is the acting physician general. Prior to serving in this role, Dr. Johnson was the most recent chief medical officer at Meadville Medical Center. Before joining the Meadville Medical Center leadership team in 2008, Dr. Johnson spent 13 years in private practice in Meadville. She is board certified in obstetrics and gynecology by the American Board of Obstetricians and Gynecologists, and is a fellow of the American College of Healthcare Executives. She is a former commissioner of the Governor's Commission for Women. Dr. Johnson has been involved in various community and regional groups focusing on diversity and inclusion and on the needs of women, and is the former board chair of the Meadville Area Free Clinic. She is past chair of the board of directors of Pennsylvania Coalition Against Rape. She has received her medical degree at Georgetown University School of Medicine and completed her residency at Vanderbilt University Medical Center. Dr. Velma Davis is Director and Chair of the Nursing Program here at Lincoln University. In addition to her job as Director and Chair, she is engaged in executing a research grant looking at the effects of mentoring and on outcomes of African American nursing students. She has been a nurse for 42 years. She is also a trained midwife, critical care and pediatric nurse. Dr. Davis is also a board-certified pediatric nurse practitioner for the last 25 years. She has much experience working with and educated the Hispanic population, especially on the subject of adolescent obesity. She has published an article on adolescent obesity and has given presentations on subjects at various forums. In 2009, Dr. Davis received the State Award for Excellence by the American Academy of Nurse Practitioners. She was also the winner of Excellence in Nursing Award for Volunteerism by Delaware Today in 2019 and received honorable mention by Delaware Today as an advanced practice nurse yearly between 2013 and 2017. Dr. Davis facilitates her own podcast, Life Chat, with Viv and Vil. She is married and mother of two. Dr. Marcella Hill is currently working as a nurse practitioner at LCH in Oxford, PA. She's been working at LCH for the past year. She recently graduated from Johns Hopkins University in 2020 with a doctorate in nursing practice. Before attending graduate school, she worked as a nurse for 5 years, mostly as a community health nurse. She attended undergrad at University of Pennsylvania, where she graduated with her BSN. She strives to eliminate health disparities by increasing health literacy through health education programs in the community to promote healthy outcomes, thus increasing health inequity. Dr. Frederick T. Faison serves as Lincoln University's Associate Vice President of Student Success, Health and Wellness, and is the university chaplain. Rev, as the Lincoln University campus community affectionately calls him, has served as chaplain for over 13 years. Since 2017, he has extended his work into a holistic concert of care for mind, body, and soul. As the Associate Vice President of Student Success, Health and Wellness, Dr. Faison oversees 4 key student success areas: counseling services, health services, Upward Bound, and the religious life and activities. Dr. Faison is servant leader of the Lincoln University Care Team. Dr. Faison is servant leader working to create success synergies. By nature, he is a campus and community connector who believes we all play an important role in each other's success. He seeks to realize the benefits to students of frontline services that are intentionally and strategically connected. Dr. Faison specifically leads in the 8 health dimensions of physical, cultural, environmental, emotional, financial, intellectual, occupational, spiritual, and social success. Finally, on our panel, we have Chief Mark Partee, who is Chief of Police and the Director of Public Safety here at Lincoln University. He has been at the helm of Lincoln University's Department of Public Safety for almost 3 years. Previously, he served on the Baltimore Police Department for over 22 years, retiring as the rank of Major in charge of the Education and Training Division. Chief Partee has expertise in logistics and major event management, which made him a natural to form and direct the Lincoln University COVID-19 Response Task Force. Collaboratively across all facets of campus, the task force has been able to meet the challenge posed by the pandemic through innovation, preparation, and compassion. Protecting the Lincoln community has been the ultimate goal of the work of the task force that has done and continues to drive it forward with nimble adjustments to meet the challenges. Chief Partee believes the relationship is the key to realizing success. At this time, we will have a brief presentation from Dr. Johnson, and then we will have our panel discussion with the fielded questions that we have received through our surveys.
Great. Can you all hear me? Great. Well, good afternoon, everyone, and thank you so much, Dr. Green-Rainey, for that introduction. I am so honored to be here as part of this distinguished panel, and really happy to be here at Lincoln for my first time. So I am the Physician General for Pennsylvania at the Department of Health, and since I came on board in the end of March been working really diligently to get Pennsylvanians vaccinated. We're in a very different place than we were last year. If you all recall last year, our case numbers were high, the highest that we've had. We had a lot of people in the hospital, and we really didn't have anything that we could do for COVID other than staying away from each other. This year, we're in a much, much different place. We have safe, effective, free vaccines that are fighting COVID. These vaccines are protecting us against death, which we've seen much too much of here in Pennsylvania, the nation, and worldwide. But it also is helping to keep people out of the hospital. Last year, this time, and even this year, our hospitals are strained with people coming in with COVID. But this year is compounded by the fact that last year we were staying away from each other. We weren't seeing flu. We weren't seeing respiratory viruses. But now those people are in the hospital. And last year, people weren't going to see the doctor for things they needed to, chronic diseases, diabetes, heart disease. But now they're coming into the hospital because of the delayed care. So our hospitals are seeing that strain. But this year, again, as I said, we've got vaccines that can protect us. We have vaccines that can protect us from those hospitalizations and worse outcomes from COVID. The Wolf administration and the Department of Health has been working to make sure that every Pennsylvanian who is eligible is able to get vaccinated. And so that means making sure that we are providing easy access to vaccines in the cities, in the rural areas, that we're getting information to people in multiple different languages, that we're getting vaccines in people in their homes when they can't leave their homes. And so a huge effort across the Commonwealth to get vaccinations. We're so excited now that kids can get that pediatric vaccine. So the 5 to 11-year-old that has been authorized, we know that we want our kids to be in school learning in person. They missed that last year, and we want to make sure that they have the opportunity to learn, to just be a kid and do all the kid things that they enjoyed before. We're coming on to the holidays, and so the weather is cold. We're indoors. We know that this respiratory virus spreads more indoors, and so that as we're coming up to the holiday seasons, we want to make sure that people get protected, that they get their vaccine, that they get their booster if it's been 6 months since the mRNA vaccine, or 2 months after the J&J. Want people to get those vaccinations to boost their immunity and make sure that we can have safe holiday gatherings together. Pennsylvania has done a great job in getting people vaccinated. We've given millions of doses of vaccines, or think about 1.5 million doses of vaccines. That number is rising every day. We're getting our kids vaccinated, but we still have a ways to go. We still have areas where people are unvaccinated or not fully vaccinated, and our case numbers or hospitalizations are continuing to go up. So hopefully we will be able to answer questions and provide good information, and also lead you to sources of credible information so that you can make the decision to get vaccinated. And if you're already vaccinated, you could tell your friends, your family members, and others about your vaccination experience, and also point them to a source of credible information if they have more questions about vaccines. So I'll stop there and be ready for any questions.
Thank you so much, Dr. Johnson. We appreciate that. Appreciate your time in coming. And we wanted to just field some of the questions so that we can have them recorded and then live streamed with our students. Our faculty and staff might be able to look back on them and receive this information ongoingly, knowing how important it is. So our first question we want to ask, I'll ask it of Dr. Davis. The first question that was received says, how long should the time frame be between the first and the second doses of the vaccines?
Okay. Good afternoon. And thank you as well, Dr. Rainey, for that lovely introduction. and for the opportunity to serve on this panel and to get us better informed. So there are three types of vaccines, COVID vaccines that are available. And we have the Moderna vaccine, we have the Pfizer, and we have Johnson & Johnson. If you receive the Moderna vaccine, they are 2 doses, and they are 28 days apart. And if you have not yet and received your booster, that's 6 months from your second dose of the vaccine. If you receive the Pfizer, that's also 2 doses, and these are 3 weeks apart. 21 days are, same 3 weeks apart, and your booster is 6 months from your second Pfizer vaccine. However, with the Johnson & Johnson vaccine, this is 1 dose. So it's 1 dose, and then your booster, instead of 6 months, it is 2 months from you receiving the Johnson & Johnson vaccine. And I hope that answers your question.
I believe it does. Also, I think you answered a portion of the second question as well. Dr. Hill, Marcella Hill from LCH is going to be answering the next question that we received. It says, if I've received shot 1 and 2 of Pfizer, and this is from an anonymous submitter, in February, the 1st and 2nd of Pfizer, and the booster in October, do you anticipate the need for a second booster? And if not, is it something I could elect or request to have?
Okay, thank you so much for having me on the panel today. And right now, there is not a need for a second booster. Right now, we're only doing 1 booster after your original vaccination. And we're just gonna have to wait and see if a second booster will be needed. But right now, there's no need for a second booster. We're not giving that. It's only a first booster. And you cannot request to have this. But in order to keep yourself safe, again, make sure you're maxing up, staying 6 feet away, washing your hands, having good hand hygiene, and that's what we suggest doing after you get your first booster.
Thank you so much. If people who have had COVID-19 are immune, why do they have to get the vaccine? As the first part of the question. The second part of the question is, since there are potential risks with the new vaccine, shouldn't people have a choice to not receive it and not be persecuted for said choice?
Oh boy. Okay. So I'm going to give you a story. There is a series of 3 shots of hepatitis B that we are required to receive. And before I came into academia, I was working in a children's hospital. And of course, you have to make sure that you are up to date with your boosters and your antibodies are good. And after several years, I was tested twice. And my antibody level for hepatitis B was still very low, and I had to keep getting the hepatitis B vaccine. Having said that, what am I saying? That the immune response for individuals vary. And because you have had the vaccine, because you have had the infection, it does not mean that you are fully protected and you are immune from getting the COVID-19 infection. And therefore, the suggestion is that, or it is recommended that even if you have had the infection, that you should receive the vaccine, because we don't know how your immune response is. And you're probably thinking, well, if you don't know, get me tested. Most people, when they do get tested, after a while, the immunity wanes. So you are never fully protected until, you are sure that your immune response is good. For me personally, if I can protect myself to the maximum, I am going to do that. I am not going to take the chance to say peradventure, because getting tested to see what my immune levels are, I may not be able to get there before I know I'm exposed to the vaccine and exposed to the disease, and it could be very detrimental. Now, of course, you have a choice. And I'm so happy that we live in a country where we have choices. We have free choices. And these choices should be informed choices. So if you decide not to take the vaccine, it is going to be your choice. However, your choice also should add not getting other people exposed or getting other people getting infected if you get the COVID-19 vaccine. So if you're going to choose not to, that's okay. But you also need, with that, to choose not to be around people and not to expose them to getting the virus because of your original choice of not being vaccinated. And I think that was fully the question.
Thank you, Dr. Davis. I appreciate that.
Thank you.
To Dr. Johnson, if you suspect a family member is a carrier of COVID-19, but they don't have any symptoms, what are some best practices to protect yourself and others, other than to isolate yourself from them, and you're being tested weekly at work?
Well, thanks for that question. I think if I understand it correctly, if you suspect that a family member is a carrier of COVID or could be transmitting COVID, I think the first thing is to get that family member tested to know for sure. We now have over-the-counter at-home tests that you can get, so you can get a test and quickly find out if that person is a carrier or if that person is infectious. If someone in your household is infected and you are not, you should do everything that you can do to try not to be in close contact. For some people, that is really impossible. If your living condition is such that you have to share a room or you have to share a bathroom, that could be really difficult. But I think the first step is to make sure that person is tested, and if they are positive, to go through the period of isolation that is required for someone who is positive.
Thank you so much. Dr. Hill, from one of our staff members, Mr. Gonal, says, should we receive a booster shot, the third, after receiving the first and the second dose of the vaccine, and when? I think that goes back to one of the earlier questions, but you can answer again just to give a clarification answer for the video.
Okay. And yes, I do believe that if you're eligible, you should get the booster shot. So right now, only adults 18 and older are eligible to get the booster shot. And it is really important because there are different COVID variants out there. So with the booster shot, it can protect you and give you a little bit more protection from the other variants. And you should get the booster for after the first and second shot 6 months after your second dose.
Thank you so much. What makes the Moderna and Pfizer vaccines different, Dr. Johnson, and why would they be different to fight the same COVID-19 virus?
Sure. So the Moderna and Pfizer vaccines, as you know, are both mRNA vaccines, and they're made by two different companies. So the way that these vaccines are made, they use a template and make some mRNA that is specifically against part of the spike protein. So these two companies are working separately, so they are not using the same template. They are making their vaccine against a part of the spike protein, but it is not necessarily the identical part. So that would be the difference in terms of these two vaccines. They're made by different companies. They both target part of the spike protein, but maybe not the exact part. They still work in the same way, but they are made, again, by different companies with against the spike protein, but maybe not exactly the same part of the spike protein.
Okay, this is a question that came from one of the staff persons that said, why did I not have a reaction to the first and second shots, but with the booster, I had a fever and fatigue? And that's just open. Anyone can answer.
So when you get your vaccine, your body is going to make an immune response. And for many people who have vaccines, all different types of vaccines, getting a sore arm or getting a fever afterwards is very common. It's a marker that you're having an immune response. But some people don't have that reaction, but still get an immune response. So it's really hard to tell. Not having one from your first or second one is not unusual. When I had my first one, I couldn't even tell. Second one, I felt a little bit. Booster, I didn't feel anything at all. But the reaction that you get may be an indication of that boost in your immune system. So it's not unusual that if you didn't notice it with the first two, when you get that booster and you increase your immune system more, you may feel more of reaction. But that is not unusual at all and not a reason for any concern.
And while I have you answering, how do we know we're not inflicting any long-term effects upon ourselves when getting the vaccine or booster?
Well, I think it's really important to recognize how vaccines work, right? And especially with this one. So let's take the mRNA vaccine. The mRNA vaccine is a segment of mRNA covered in just a droplet of fat that goes into your muscle. When your body gets that mRNA, you make a piece of the spike protein and your body makes antibodies to it. Within a couple of days, that mRNA that was in the vaccine and the spike protein bit that you made is gone from your body. It's degraded and it's gone. And so there's nothing from that original vaccine that's going to be in there long term for you. On contrast to that, when you get infected with the COVID virus, that is a virus that goes into you. So your body is still going to make the antibodies against that virus, but the virus is replicating in you and it damages cells in your body. That's why people who have COVID can get pneumonia, they can get lung damage, they can have some long-term damage because of the damage that the virus causes to you. The vaccines that we have, the mRNA vaccines, have no COVID in them. And so nothing in that vaccine can damage your cells. What you get from the vaccine response is your immune response. Same thing you would get from the virus, but you don't have the damage that the virus causes you.
Thank you so much. If the numbers of the virus keep rising, will there be another shutdown of schools, businesses, and daycares, et cetera? If I could get the answer of the schools shut down from Chief Partee.
Good afternoon, everyone. So in reference to shutting down, I think we have a plan in place in reference to having everyone vaccinated and our testing protocol. Because we have that in place, I don't foresee a shutdown for Lincoln University. Individuals and institutions that do not have those type of plans in place, they may experience that because they have not been proactive in terms of trying to keep things under wraps when it comes to the pandemic. I can't foresee the future, but my feeling is that if everyone takes advantage of these tools that we've been provided in terms of this prophylactic response with the vaccination, I think we'll be a lot better off. The replications that we're seeing and the things that are coming out of this are because everybody has not taken advantage of or had the opportunity to take advantage of the vaccinations. Just a little aside, everyone in my house is vaccinated, but my son just recently had a breakthrough infection. And that's because someone in his circle decided that they did not want to get vaccinated. So these are the things that we have. We had never seen a case inside my house, but because someone else did not want to take advantage of that, we ended up having to go through this. So it's along the lines of seatbelts. You know, you have a seatbelt. Is it going to keep you alive during a crash? Most likely it will. But is there a chance that it might not? Yes. But do you want to take the chance on not wearing the seatbelt and getting the worst part of it, or do you just want to try your best to do that? So shutdowns and all that stuff can be avoided if we just take advantage of the opportunities that are out there by way of the vaccine.
Dr. Faison, I just wanted to elaborate a little bit further beyond what Chief Partee just mentioned with regards to the church side and community. I know a lot of people were in a depressed state from being at home without being able to have that relational environment that they are accustomed to, and a lot of our worship services and a lot of other activities were affected by that. What do you see as one of the things that we can do to eliminate that from occurring again in our communities and our relational environments that we want to have here on our campus?
Well, obviously, thank you for the opportunity to participate in this discussion. Obviously, we are working, as we say, all the time, from my hat as chaplain, to be intentional about being relational. And what we've learned is COVID has tried to rob us of our relationship. And so we've tried most certainly to be intentional with making offerings throughout COVID via the internet, and making sure that we have it on Facebook Live so that people can have some kind of conversation. Or even when we are here on campus, we offer those resources to our students through spiritual life. But we're not only just thinking spiritual life, we're thinking about our students being holistically well. And so I'm glad to have Chief on the end of this table and all of my other colleagues on the dais, because it's representative that we have to be intentional about being relational across the campus. So thus, that is our care team. And so we care every week. We care so much that we meet to have discussion across the landscape of how we can help the ethos of our campus and make sure that our students load up their status information. I'm putting the plug in there. Go load up your status information, students, faculty, staff. We need to know, right? And so we've done a plethora of things on campus, from serving ice cream at the top of the U to meeting with classes as we are doing today with our class deans. So it's still in that tenor about being intentional, about being relational. Before I put the mic down, I want to send a shout out to our community who has been completely responsive. I'm so grateful for Dr. Hill being by me now and her team, and of course to our fabulous Nurse Rainey and her team. Talk about being intentional, about being relational. I think Chief remembers when we went on this massive testing campaign when our students returned. I think we tested over 900 people. We tested the Airmark staff that cooked for us. We tested the staff that cut the lawn. We tested everybody. And so we are trying our best to continue to be intentional about being relational. And so we are grateful that our community came out. Y'all came out, put on your little vest, and help us. And I think Lincoln is an expression of that. So that's what we've done. That's what we're committed to do. We are intentional about being relational. Thank you.
Thank you so much, Dr. Faison. Dr. Johnson, do you want to add?
Yes, if I could just add, agree wholeheartedly, Chief Partee. I think that before, last year we used shutdowns. it was a really blunt instrument, right? Because we didn't have anything better. But now we've got safe, effective vaccines. And so we've got a surgical instrument to cut these cases down. So that's what we are doing at the state. We're focusing on our vaccination efforts, again, to make sure that everyone has access, even if they speak a different language or even if they can't get to a vaccine clinic. We want to make sure that everyone has access because we have the way to prevent shutdowns. We have the way to decrease cases and hospitalizations and deaths. And so we want to make sure that everyone takes advantage of that sharp tool that we now have.
Thank you so much.
Just to add a little bit to that as well, we have seen the effects of what shutdown has done to students, people in, even daycare, businesses, and that is something that I do not look forward to or that we want to see happen again. So I know that each person has the responsibility to make sure that it does not happen because it does have a psychological impact on people. I have seen it. It has a psychological impact on students, not only at the college level, but also in high schools and the junior high schools. It does cause an impact. So when we see what it can be done, why not help to make sure that this does not happen again by doing our part in what we need to do to stop the spread of COVID-19. And their suicide rate was very, there was a spike among students in high school as well as students at the university level. And although the research has not been fully done to see, but the reason is pointing to them being home, being away from friends, being locked down in their homes. My daughter is a psychologist, and just listening, she will never need, be short of having patience because parents have now taken it in their hands to say, I need to bring my child to be seen, to be counseled because I see what is happening at home.
Thank you so much. Dr. Faison?
May I add to that as AVP, I just want of health and wellness, I do want to let the community know that we are encouraging our students who are also feeling the impact, and along with our staff, about the impact of the virus. So the virus doesn't necessarily only impact you physically, it can impact you spiritually. It can impact you emotionally. And so we have committed again. I see Dean Joseph here. We most certainly want to make sure that our students are realizing student success in the classroom. And so what we have done to that end, we're trying to make sure that we have resources. We just have identified Timely MD, where our students can have access to 24-hour care for someone to talk to. So we're really grateful about that we were able to realize that. We have added to our staff student success coaches that are in the residence halls with students. We have utilized the amazing deans that we have of the classes so that when we need to call students together to engage them in conversation, to make them aware about uploading their there it is, I put it out there again, about uploading their status, that we can have those deans to be in contact with them. We have provided our counseling services, and we have done a number of First Thursday activities. So we are continually investing in the student and in the campus community so that we're not by ourselves. And I want to say that to you, COVID has come, and we have to be conscientious that the pandemic, that we don't have to panic in the pandemic, and that we can we can utilize the resources available to us, and that we can capitalize on the counseling center, that we also have those services available even to the faculty and staff, all of those resources that are there, so capitalize on them. And we also have a chaplain too. So we are just availing ourselves over and over again to our community to be intentional. Thank you.
Thank you so much. We appreciate you, all of you on the panel, for your answers and the discussions from the questions that we have received from across the campus, from our faculty, staff, as well as from our students. And I do understand and I do know that the last question that we have received has probably already been answered as well. Will we have to get booster shots every 6 months? It hasn't been determined as yet, but boosters are available for any persons that would want to receive them at this point in time. So that answer we did receive earlier. But I just wanted to end with one final question from here. We do understand also that OSHA has recommended that employers with at least 100 plus employees should also have their staff mandated to have the vaccination. Where are we, Lincoln University, on that stance? Chief Partee?
Try this again. All right, so as many of you know, Lincoln University has mandated vaccines, but just with any other mandate, there are religious or medical exemptions that come when you have proper documentation, and that is being handled by our institutional equity department here on Lincoln University's campus.
Yes.
So we are moving towards trying to get as many people vaccinated as possible. Dr. Rainey and her staff, vaccination clinics every week. We have one today. So there's really no choice, really no excuse if you can get vaccinated to not get vaccinated. We've made it possible for you to do it. If you don't feel comfortable doing it here, you can go to CVS, Walgreens, Rite Aid, anywhere and get it done. I have to keep pushing that, and I know everybody on the panel is also pushing the fact that if we want to fight this thing, this invisible beast that is taking over our lives, we have to take advantage of the tools that are there for us to utilize, right? It's the difference between if you're building a house, would you rather use a rock to put the nails in, or would you rather use a hammer? We have a hammer. Let's use the hammer and get this thing done. We can't keep going around talking about how things are bad and this, that, and the third, and we have something there that can help us out, and we're just saying, well, I don't trust it. I trust the vaccine more than I trust being on a ventilator. I'm sorry. That's just how it works. So in my business, you just have to be straightforward and blunt, and that's just the way that I have to go with that. So Lincoln University is moving forward with our vaccination program. If you have any questions, it probably was answered here in reference to vaccinations. We have a wonderful wealth of knowledge here. And this is what I do with my family. I remove any and all excuses, right? So we're removing any and all excuse right now to not be a part of this fight.
Thank you so much. I just wanted to say a special thank you to everyone who came out to participate and be part of this opportunity to engage our questions and have answers that should decrease COVID vaccine hesitancy among our campus community as we learn, liberate, and lead here at Lincoln University. And I just wanted to open up also the floor just quickly if there's one or two questions from the floor that was not already asked or answered here. Yes, Nurse April?
Hi, I just want to thank Dr. Johnson for saying what you said about the components that are in the vaccine, that there is no coronavirus in the vaccine. I just wanted to say that nice and loud and repeat it, so because that's a lot of the excuses that I'm getting. I don't want anybody to put the corona in me, and so I wanted to clarify that. Also, I'm getting a lot of feedback from the students saying, especially those that are positive, but I feel fine. Can you touch on that? Yes, I know you feel fine, but.
So yes, thank you so much for that question. I think that we learned a lot about this virus during this pandemic. It's the novel coronavirus because It was new to us, and there are a lot of things that we didn't know. One thing that we really found out, though, is that there is a lot of asymptomatic transmission. So when you feel fine, you can be transmitting the virus to other people. And then what we also found out is that you're transmitting even before you get sick, right? So as soon as you have symptoms, you've already been transmitting that virus for a couple days before that. So the feeling fine is not a barometer, and so that's why people who are not vaccinated, we're saying, you know, you need to wear a mask if you're in these public places, because you're not going to know when you're transmitting until it's too late, when you've already infected other people. And if you can indulge me, being an OBGYN, I've got to mention pregnancy and reproductive concerns, because that question didn't come up. But there's been so much misinformation about pregnancy and vaccination. As I said before, there are no components of this COVID vaccine that's going to be in you for long term. That gets degraded, is out of you. And something that people who are pregnant or want to be pregnant have to realize is that your risk with COVID is much higher when you're pregnant. Pregnancy changes your physiology. In pregnancy, you're a lot more likely to get blood clots. You're a lot more likely to get any lung damage because of the changes that pregnancy has on your body. So that's why we've seen pregnant women with COVID are more likely to end up in the ICU. Pregnant women with COVID are more likely to be hospitalized and have worse outcomes. But I think people are concerned about their babies. Pregnant women with COVID have more premature babies and stillbirths. So pregnancy with COVID is bad. The vaccine has no COVID in it, has no components that are going to affect your fertility. And so vaccine also will make you make antibodies that can protect your baby early on. So highly, highly recommended. We've, I know in August we saw a spike in deaths in pregnant women with COVID. So really strongly recommend that people who are pregnant or want to be pregnant to get vaccinated and not to wait, because COVID is a lot worse on your system when you're pregnant. And that's my soapbox for the day.
Thank you so much. We appreciate that. Thank you, Nurse April, for that question. And do we have any other questions? Yes, Dr. Baskerville.
Sorry about that. So right now, there is no FDA or CDC approval for a fourth booster. So they're probably still researching and figuring out if that's what's needed or not, but right now there isn't approval for a fourth booster for anyone.
So if I can add, you're absolutely correct. There's no fourth booster that is authorized at all. But for, as you mentioned, for the immunocompromised, it was recommended that they get that third dose, because these are people who are not mounting the immune response as the rest of us are. I know that in the pipeline, AstraZeneca has a product that they are hoping to get authorization for as prophylactic for COVID. So these are for people who are immunocompromised and they've been getting their vaccines, they're not mounting an immune response at all. This would be a shot that they would get every 6 months to prevent them from getting COVID. So that's something in the pipeline. It's not available right now, but for those people who are just not going to mount a response at all, no matter how many vaccines you give them, there may be some help on the way.
So we will keep our eyes open for that, because I do know that there are persons who have that as a concern for varying reasons, that they have become immunocompromised, whether it is from medications or from illnesses themselves. We will keep our eyes open for that. If there are no other questions that we have, one additional question? There's two, I'm sorry, I can't see you.
My question is, we have the new variant going around. If you're fully vaccinated, are you immune to the new variant?
To the new variant?
The new variant
Mhm.
Omicron.
Okay.
So if you're fully vaccinated, are you immune to that variant?
So thank you for that question. I think that everyone has heard about Omicron. It's in the news now, but it is very new that we're identifying it. So there's so many things that we don't know about it. What we know about Omicron that makes us concerned is that it has a lot of mutations, and a whole lot more mutations than we've seen before. And some of the mutations that it has, we've seen it in other variants that affect the way that virus operates. So, what we've seen with Delta, right, is that Delta has mutations, and Delta was transmitted so much easier than the other strains that we had, and Omicron has some of those mutations. We've also seen some of the variants that had mutations that caused it to be not as responsive to some of the treatments that we've had. And another concern is whether or not it's going to be affected, whether or not our vaccines are going to be effective. We don't know that yet, and I think scientists say that it's really going to take a couple of weeks for us to get some more research to be able to know that. But what we know is that vaccinations still seem to be protecting against severe disease, hospitalization, and death. And so that getting the vaccine, even with the variants that we've seen to date, and probably even with Omicron, we know that the risk for death and hospitalization will be much reduced. We also know that the recommendation now is everyone over 18 to get that booster dose. That booster dose is going to increase your immune system, and we believe that that is also going to make us better prepared for Omicron. So much we don't know yet. We're learning every day, but getting vaccinated and getting that booster is our best protection against any of the variants to date, and probably even Omicron. Hope that answers your question.
Thank you so much, Nurse Tulu, for that question. I do believe that we are running out of the Greek alphabets. So we're at O. We've only got to get to Z. So just keep your eyes open. It's not over, but we want to be prepared. And this is our best defense to mount the defense against this virus. I just also wanted to add in our closing remarks that, as it has been stated by Dr. Faison, the Moderna vaccine is being administered today in health services in the Wellness Center. Please share that with those that you know, those persons that you believe might be interested in receiving the vaccine, whether it is their first or their second dose or even their booster. They can receive that in health services today in the Wellness Center. Also, please upload your vaccine cards to the lucovidtesting.com portal, where you will be able to place it under one of three sections, whether it is a partial dose, meaning your first dose and you're on your way. It's always good to know, gives us some track record of where you are in the process, or fully vaccinated, meaning you have both of your vaccines if you are using the Pfizer or Moderna vaccines, or even if you've just done the one dose of Johnson & Johnson, you will be considered fully vaccinated then. Or if you need to upload your card under fully vaccinated plus booster, there is a section for that as well. All exemptions must be approved through the Office of Institutional Equity, and they are in Wright Hall. You can see Mr. Garlick or Ms. Chambers if anyone has any questions about that process and the forms that need to be presented for that approval. Finally, I wanted to give a special thank you to our panelists, Dr. Denise Johnson, our Physician General here in the Commonwealth of PA, Dr. Marcella Hill, our nurse practitioner at LCH Health Center in Oxford, PA, Dr. Velma Davis, our nurse practitioner and chair of the nursing department here at Lincoln University, Dr. Frederick Faison, our chaplain and associate vice president of LU's Health and Wellness Division of Student Success, and Chief Mark Partee, LU's Director of Public Safety, Chief of Police, and our COVID Task Force. Again, special thank yous to Mr. Ricketts, Ms. Cotton, Mr. Box, Mr. Young, Ms. Cook, Ms. Roden, Dr. Ayuwu, our students, faculty, and staff, and of course, whose help I could not go through a day without, my Health Services Center staff. Thank you all so very much. Thank you for being present, and we look forward to seeing this information again and again. Since it's being recorded, we will be able to obtain this information over and over. You'll be able to share this information also with others. Thank you again.